Lauren is a 25-year-old woman with right-sided headache. When you're consulting over the phone, make sure that you confirm patient's identifiable. Usually 2 identifiable are required: patient's full name and date of birth. Before you start the consultation, check with the patient whether it's a good time to speak to them. Sometimes if the patient might be driving or if there's people around, then it might not be suitable for them to carry on with the consultation. If the patient is happy to go ahead with the consultation, then what will you ask the patient? Start with an open question so you can understand the story of the headache. You may ask the patient, how did your symptoms start? Could you tell me how did this headache start? The patient may tell you that for the last 4 weeks, they've been having headache once a week and now it's becoming more frequent, having headache twice a week. What else do you want to know about this headache? The specific questions to know more about the nature of the headache. What's the severity of the headache? Any associated symptoms such as nausea, vomiting, numbness? Do the patient have any aura, visual loss, duration of the symptoms, anything that triggers a headache such as stress, chocolate, cheese or wine? You may want to know whether the patient have any caffeinated drinks, what the patient have done to relieve the symptoms. Have they taken any pain relief? Does the patient find that the headache gets better in a dark place or when she sleeps? You need to know about exacerbating factors, relieving factors. Having this information will help you diagnose what type of headache this patient is suffering with. Consider serious pathologies by asking red flag question. Has the patient sustained any injury, any fever? Does the headache get worse in the morning or bending over or when the patient coughs? Does the headache start suddenly? Is it a thunderclap headache? Has the patient had any weight loss, any loss of consciousness? Have they collapsed? Have they had any seizures? These information are important to exclude serious pathologies. Be mindful this is a woman who may be on contraception, so make sure that you ask about contraception because this can have implications should the patient have migraine with aura. Don't forget to ask about ideas concerning expectation. Ask the patient whether they have any thoughts as to what is going on because this will give you an insight as to what they're thinking. For example, if this patient told you that they're worried that this could be a brain tumor, then you know that this patient is quite worried, and you may want to ask the patient what's the reason they think this could be a brain tumor. They may tell you that there's a family history, a relative has been diagnosed recently, or they've watched a program on TV. Ask the patient whether they have any concern. So if the patient is telling you that they think this is a brain tumor, make sure you acknowledge and validate their concern because this will help you score in interpersonal skills, and you need to remember this because you need to address this concern in the second part of the consultation. Ask the patient what they're hoping from this consultation because this will help you to manage the expectation. If the patient told you that they want to have an MRI scan, then you know that you will need to address this expectation later. So make sure that you ask about ideas, concern, and expectation. We also need to know how this headache is impacting on the patient's life and work. So ask the patient about how has this affected things at home, how has this affected things at work, has a headache interfered with work, have they had to take time off work, because all of these would help you to know how bad is a headache. If it's appropriate, also ask about smoking and alcohol. Normally there will be information on the patient's record about whether they smoke or alcohol, so make sure that you use this information if you're asking further questions. So you may want to ask the patient, I can see on your record that you drink alcohol. Sometimes our habits can affect our health. Could I check with you how much are you drinking? Have you noticed any pattern with the headache when you're drinking? Make sure that you signpost your question and are sensitive when you're asking these questions. A pitfall to avoid when asking questions about alcohol is to signpost it as something personal. Some patients will take it personally if you ask them, may I ask you a personal question? How much do you drink? And then they may not want to tell you exactly how much they drink. So if you ask the question without making it personal, just ask the question in terms of how this can affect the headache or how our habits can affect our health, then your consultation may be more smooth. Once you have taken a focused history, time to move on to examination. In the context of telephone consultation, it is easier to complete within 10 minutes for the RCA, as for the examination, it will take you less time because you have the option to examine the patient remotely, or you can bring the patient to perform an examination, but you don't need to do the examination over the phone. So you can explain the examination, what you want to examine, and justify the reason for the examination and why you want to bring the patient for a face-to-face appointment. This will help you score mark for examination, but you don't have to spend too much time on it during the telephone consultation. So what will you want to examine in this patient? Would you want to bring this patient for a face-to-face appointment? If so, why? In this scenario of a patient presenting with headache, you may want to examine this patient. You may want to perform a check of the blood pressure. You may want to check the cranial nerves, including fundoscopy. If you want to examine this patient, then you can offer a face-to-face appointment for the examination. Make sure that you explain clearly why you want to do this examination. Tell the patient that I'd like to examine your blood pressure just to make sure that your blood pressure is not high. I want to check the nerves in your head and face. I also want to have a look in the back of the eyes, because if you have a high pressure in the head, then it can cause headache and it can impact the eyesight. So make sure that you explain clearly to the patient why you want to bring them, and ask them whether it will be suitable for them to come down to the surgery. Let them know that your practice has taken safety measures with use of personal protective equipment to reduce risk of COVID-19, and it will be safe for them to come down to the surgery. So make sure that you include all this information, because then you will score higher in interpersonal skill. After you have explained about the examination, then it's time to move on to clinical management. In telephone consultation, it can be more daunting to propose a management, but if you want to score points, then it's important that you make a clinical management. You can't just say, let's bring you down to the surgery so that we can have a look at your nerves and have a look at the back of your eyes, and then we'll take it from there, because that's inadequate to score in clinical management. So you need to address the ideas, concern, and expectation of this patient. Do you remember what was a concern? This patient was worried that they may have a brain tumor, and the expectation was an MRI of the brain. So you need to address that and explain to the patient that investigations are not generally required to diagnose this type of headache that they have. From the history, this sounds as a primary headache, a migraine, and usually there's no need to request an investigation for migraine. Let the patient know that a brain tumor is rare, but you will examine them, and if there's any signs of any abnormalities, then you will consider doing brain imaging. From the history, let them know whether this is something that's likely or unlikely. How will you address this concern that the patient have about having a brain tumor? Explanation and reassurance is important in this scenario. So it's important to let the patient know that investigations are not generally required to diagnose this type of headache. And from the history and assessment you've done so far, you may not think that this is a brain tumor. However, you will examine them and you will consider this, but it is very unlikely because the headache seems to get better with darkness and with paracetamol. So you think it's more towards a migraine. Ask the patient what they know about a migraine. Think about your differential diagnosis. So yes, this could be a migraine. Make sure that you don't get blindsided, focusing only on one diagnosis. This patient could have a tension type headache, medication overuse headache, subarachnoid hemorrhage, a brain tumor, or meningitis. So make sure that you think about all these differential before explaining your working diagnosis. How will you explain to a patient about migraine? Explanation needs to be without any jargon and in simple lay term. Before you start explaining about migraine, it's useful to know the patient's baseline knowledge. Ask the patient how much do they know about migraine. If the patient doesn't know anything about migraine, then you need to use simple language and explain it from scratch. If the patient tells you, oh, their mother had migraine and used to be really bad, then you can build on the knowledge that the patient has. So you could explain to the patient, migraine is a common type of headache that is usually felt on one side of the head. People also feel sick and become more sensitive to light or sound with the headache. It usually gets better with sleep. Some people may experience specific warning signs before the migraine, so this is called a migraine with aura. Once you have explained to the patient about the diagnosis, then you need to propose how you will treat this migraine. Treatment can be classified into lifestyle changes and medical treatment. Now, because you haven't examined the patient yet, then you may say to the patient, depending on what we find from the examination, I think this is a migraine, and what we can try to do is we can try to make some lifestyle changes And based on the history from the patient's psychosocial history, then you may offer some lifestyle changes such as avoiding any triggers. If they spend a lot of time on the screen, then making sure that they take regular breaks, making sure that they drink enough water. Or if the migraine is related to stress, then relaxation exercise can help. When you discuss management with the patient, make sure that it is a shared management. So offer options to the patient and explain the pros and cons of each option. So for example, if you're going to start this patient on a medication, for example, if you think that this acute migraine needs a triptan, then you need to talk about the triptan. What are the pros and cons of the triptan? If the patient has cardiovascular disorders such as ischemic heart disease or hypertension, then a triptan would not be recommended. You could also offer antiemetics such as metoclopramide. Make sure that you also discuss the pros and cons and side effects. If the patient is not keen to use triptan or antiemetics, then they can use simple analgesia such as NSAIDs or aspirin. If the patient is having frequent attacks of migraine, it is worth considering prophylaxis treatment. Two options available, propranolol and Topiramate. With propranolol, be aware that if the patient has asthma, then propranolol is contraindicated. Topiramate is another option for prophylaxis. Once you have discussed the medical treatment with the patient and agreed on which medication to start, and you explain about the risks and side effects, then you may conclude by arranging a follow-up in 4 weeks' time to discuss about the frequency of the attacks, effectiveness of the treatment, whether the patient have any adverse effects, whether the treatment has worked. You can also advise the patient to keep a diary of the headache so that it's easier for them to recall. Don't forget about safety net advice. Make sure that you're specific in your safety net advice, what sort of symptoms the patient need to look out for, and if the symptoms not controlled, then to reconsult. If the diagnosis is uncertain, you may consider a referral to neurology. If you have any suggestions, any comments about how you would approach this case, please let me know down in the comment section. I look forward to reading your comment. If you have any suggestion on what case to cover next, please let me know down in the comment section. I hope you like this video. If you enjoy watching this video, please smash the like button. Make sure you subscribe so that you don't miss any future videos. Take care everybody. Bye bye.